Hi, I'm May Ryan, a Master of Library Science student at Emporia State University. For the past 2 years, I've focused on special libraries, specifically medical libraries. One of my final classes in the MLS program is the history of libraries. My research project for this class will of course discuss the history of medical libraries. The format for this project is a blog found at maythemedicallibrarian.wordpress.com. Since blogs can be so dynamic with adding new content, it seems that keeping a blog is a good way to keep researching medical libraries. My intent is to maintain the blog past graduation to help sustain my professional development. For the purpose of the research project, there will be 10 blog posts pertaining to the history of medical libraries. 2 of the 3 existing posts are about the chronology of medical libraries, from ancient times to present day. Let's briefly go over that timeline. The first civilizations to keep records, which included medical records, were Babylon, Mesopotamia, and Assyria. These early medical collections often had the same disastrous fate as other libraries because all types of information were often stored in the same place. One exception was in Assyria with King Ashurbanipal, where medical records were written on clay tablets. When the Babylonians conquered and destroyed Assyria with fire, the clay tablets remained. In a short tangent, I saw an article just last week where the researchers found another clay tablet of the Epic of Gilgamesh from the ancient kingdom of Babylon. These clay tablets are proving to be the longest lasting medium in terms of preservation. The obvious downside is that they are not spatially economical. Now back to the medical library timeline. During the classical period of Greece and Rome, these two countries characteristically gathered all types of knowledge, but surprisingly, Rome did not have as much concern for medical literature. So, Roman libraries were not as extensive as the libraries in Greece, and especially Alexandria. Let's now skip to the Middle Ages, which includes the Dark Ages. Although learning was suppressed in Europe during the Dark Ages, the Middle and Far East flourished with knowledge. For example, a medical school in Cordoba, Spain, once held 225,000 volumes. Once the Renaissance began, a number of universities emerged, and various medical societies began to form. There was also the rise of the monastic medical library. The first modern medical libraries were maintained by schools of medicine and medical societies in Europe. The numbers of these groups increased greatly, and this carried over into the colonization of the United States. In 1836, the National Library of Medicine came into existence, and it has become the greatest resource of medical information in the world. That was an abridged history of medical libraries. You can find more information, including references, at the blog. For the remaining posts, I will research the history of specific libraries, such as the National Library of Medicine and the Mayo Clinic. I would also like to write about the history of bioinformatics, an important interdisciplinary field that involves developing tools for understanding biological data. I live in Utah, and the University of Utah was among the pioneers for bioinformatics. Many medical librarians study bioinformatics to be more on the same level of the communities they serve. And since I live in Utah, I want to write the history of 2 local medical libraries, the Primary Children's Hospital Library, where I currently volunteer, and the Eccles Health Sciences Library, where I completed a practicum for the Emporia MLS program. The Children's Hospital Library is just a short walk away from the med school library. A lot of research happens that directly affects treating children. It might be interesting to see how far back both of these libraries have been working together. Finally, I would like to discuss the history of new technology in medical libraries. A number of databases support various apps that healthcare providers use to diagnose and treat patients. When did those apps really start to take off, and which apps are the most popular? This section will obviously be a recent history that will encourage us to think more about the future of medical libraries. These subjects are what my research project will cover. I aim to write 2 to 3 posts a week, so check the website every week for new content. Thanks for viewing this presentation.